Tumor grade tells how abnormal the cancer cells look under a microscope, compares them to normal cells from the same tissue. Also looks at how fast the cells are dividing, mitotic activity. Low grade equals cells look more normal, grow slowly. High grade, cells look very abnormal, poorly differentiated, grow fast. Higher grade, more aggressive behavior. Tumor stage tells how far the cancer has spread in the body, based on imaging and pathology reports. Uses TNM system, T equals tumor size or depth of invasion. N equals spread to regional lymph nodes. M will spread to distant organs, metastasis. M is most important for prognosis. Stage is more useful than grade for predicting survival. USMLE style questions. Question 1. A 58-year-old woman has a biopsy of a breast mass. The cells show marked atypia, irregular nuclei, and high mitotic activity, but the tumor is small and has not spread beyond the breast. What best describes this cancer? A. Low grade, low stage. B. High grade, low stage. C. Low grade, high stage. D. High grade, high stage. E. Undetermined. Correct answer B. High grade, low stage. Explanation. High grade cells look very abnormal, dividing quickly. Low stage, tumor is small and hasn't spread. This combo is possible, especially in early detection. Why not others? Cells are abnormal, not low grade. C. Tumor has not spread, so not high stage. D. There's no spread. Enough information is provided. Question 2. Which of the following features is most useful for predicting a cancer patient's survival? A. Mitotic rate. B. Nuclear pleomorphism. C. Grade D. Stage. E. Tumor size alone. Correct answer D. Stage, how far the cancer has spread, is the best predictor of outcome survival, especially the M metastasis part of the TNM system. Why not the others? A and B, part of grading, not staging. C. Grade gives aggressiveness, but not as strong a predictor as stage. E. Tumor size is part of T, but M and H in importance. Question 3. A 67-year-old man has a colon cancer that invades through the bowel wall and has spread to 4 nearby lymph nodes, but not to distant sites. What is the most likely stage component? A. T1-NOM1, B. T2-N0-MO, C. T3-N2-M0, D. T4-M1, E. T2-N1-M1. Correct answer C. T3-N2-M0. Explanation. Tumor invades through the wall. N2 involves 4 plus lymph nodes. M no distant spread. Why not the others? M1 means distant spread, not true here. B. N0 means no node spread. M1 is incorrect. E. M1 is incorrect. Question 4. Which of the following correctly describes tumor grade? A reflects the number of lymph nodes involved. B indicates the amount of distant metastasis. C measures resemblance to normal tissue. D always correlates with tumor stage. E determines if the tumor is benign or malignant. Correct answer C measures resemblance to normal tissue. Explanation. Grade tells how closely tumor cells look like normal cells. Low grade equals well differentiated. High grade, poorly differentiated. Why not the others? A and B, these describe stage. D, grade and stage are not always correlated. E, benign malignant is a different classification. Question 5. A patient with a 3-centimeter skin tumor has a biopsy showing well-differentiated cells. However, imaging reveals multiple liver metastases. Which statement is most accurate? A, the patient has a low-grade, low-stage tumor. B, the patient has a high-grade, high-stage tumor. C, the patient has a low-grade, high-stage tumor. D, the tumor is benign. E, the grade is more important than the stage for prognosis. Correct answer C, the patient has a low-grade, high-stage tumor. Explanation. Well-differentiated, low-grade. Liver metastases equal high stage, M1. Even if the cells look normal, widespread disease, worse outcome. Why not the others? A, the tumor is high stage. B, grade is low. D, metastasis confirms malignancy. E, stage is more important for predicting survival.